Hi, my name is Dr. Mohamed Hany. I'm a bariatric surgeon in Egypt. And I want to spend a few minutes talking about how patients can choose between a gastric bypass and sleeve. Once the person tried diet and exercise are not potent enough to get the obesity problem under control. So the next common step is to try to choose between these two surgeries. Before I get into medical facts and medical comparison between the gastric bypass and sleeve, I want to emphasize that this needs to be a conversation between the patient and the surgeon. Patients who research this process before going into the office usually come in with a sense of attraction or vibe with one of the operations. And my experience, that's usually a pretty valid factor to take into consideration. The key thing here is that the patient is going to put this operation to work in their own body system. The surgery will be their tool for many years to come, and so it is absolutely important that the surgery seemed like a good fit for them at the end of the conversation. Now we are going to talk a moment about the medical differences between the two operations, but I'd like to begin to talk about the similarities between these two operations. First of all, both operations are done laparoscopically. That means that several little incisions, minimally invasive with TV camera. People are typically in the hospital for one night, about 80% of the time, sometimes 2 nights. And people typically are ready to go back 10 days or 2 weeks after surgery. What also is the same between the two operations is that we are going to recommend for people to take some extra vitamins daily for life in our own practice. That recommendations is the same for both operations. In fact, research is showing us that gastric bypass have some food absorption in comparison to a different operations that duodenal switch, which is had significantly abnormal absorption. Now in discussing the mechanisms of both operations, I'd like to emphasize that we are dealing with the metabolic condition of the obesity disease. Just briefly, everybody of us have a fat control system. It's a complex, powerful control system for our patients with obesity. It gets significantly out of balance, and so it can be said that our patients who have obesity have a situation where the body wants them to store all the excess fat, even if we know logically and intellectually that that fat is not healthy. The therapy needs to get to the core of that imbalance, okay? It needs to actually go in and readjust the fat storage system, or in a sense, change the appetite. And this is different than changing the amount of food that a person can hold. Okay, we noticed that the sleeve operation, we have removed a very huge part of the body, of the stomach, so we have less capacity for food. But this is not the important factor. The most important one, that we are removing a part of what's called hunger producing cells, which is called ghrelin hormone. This hormone is concentrated in the fundus of the stomach. This part of the stomach is considered the largest part of the body which produces this hormone. When removing this part of the stomach, we feel less hungry. We are actually changing the metabolism. And what's very interesting is that the hormone change, which is the only part of the story. Okay, the sleeve and also the gastric bypass have been found to lead to positive changes profile of the bacteria in the colon. Actually, I'm not performing operation in the colon, but we have changed the bacterial content, and this does have an impact on weight. Also, the operations change the bile, which is one of the important digestive juices of the body. We change it from unhealthy to a healthier one. So again, the metabolism is the key. The surgery is not only changing how much food a person can hold, but more importantly, changing how much a food a person wants. So that now with the help of the operations, the person is working with their body for lower weight instead of working against their body, which is fighting to maintain weight. So now thinking about how gastric bypass works. So the gastric bypass, yes, it does have a smaller pouch, so less food capacity, but notice that it's going to recognize how the food flows straight down into the intestine where digestive juices are coming together. And the reasons that seems to be important is because the duodenum has a very complex set of neural, hormonal, reflex pathways that actually seem to become a part of the problem when people have the disease of obesity. And so bypassing this section is very important. Remember, it's called a gastric bypass. Bypassing this section leads to near immediate improvements in hunger levels, fat storage, and insulin sensitivity. I should note here that the gastric bypass is more beneficial for diabetic patients. Now, people who are comparing these two operations, of course, they want to know what are the outcomes, what are the risks, and there is just a little difference between these two operations. Okay, gastric bypass does have a slight statistical advantage in terms of weight loss than the sleeve. The gastric bypass is actually a bit more effective for diabetes and reflux disease. The sleeve is useful when a patient has a previous extensive operation in the middle of the abdomen. So if you can expect scar tissue involving the intestine, here it might be difficult to get mobilized for the gastric bypass. The sleeve is more beneficial because we have just to work in this area to accomplish the surgery that we need to do. Okay. The other couple of conditions where the sleeve might be better choice than gastric bypass when the person have an ulcer history. So many of the aspirin and other related medications are more prone to do an ulcers in a gastric bypass patients. So sleeve appears to be more resistant for this type of scenario. So those are some of the ways medically that we might choose between gastric bypass and sleeve. One other condition which can make a difference, it's what is called dumping syndrome, which occurs more frequently with gastric bypass. Dumping syndrome occurs mostly after taking a sugary meal. And in the setting of gastric bypass, sugar should cause dumping syndrome, which is cramping, nausea, and usually diarrhea, which lasts for about 45 minutes. Okay, but I want to assure you that people who have gastric bypass actually rarely facing this syndrome. Okay, when they follow correct diet, which consists of green vegetables and protein, so dumping will rarely happen. So it turns out that the risk comparison of these operations is actually very similar. The sleeve looks a little bit simpler in the diagram. So we think that the complications will be less in sleeve, but in statistics, we have two major complications, which are bleeding and leak. And both operations share these complications. But fortunately, when we are looking to our statistics, we found the incidence of these conditions are very low. So in summary, both gastric sleeve and gastric bypass are both reliable operations, and patients are going to choose either one of them will achieve substantial health benefits that lasts for many years. Thank you.